Dr. Blake Staker here with Westside-Medical. Today we're going to go over what my rehab protocol I use for the low back with the bands I have in the office. So we get our bands from Westside Barbell, and what we want to do is we want to work the whole entire area. So we want to work the front, the sides, as well as the back. And we like to do high reps. When somebody comes with an injury, you want to focus on the high reps to kind of pump out that inflammation, as well as bring the blood for the healing process. So the first, we like to have patients do are just side bends with a band. That's going to work your QL as well as the little inner transverse muscles back there. So you have the patient stand up nice and tall. You want to kind of just bend at the side, right like this. And if they go about 30 degrees, if it hurts, you want to have them stop and not go quite as far, and just have them just pump those back muscles. And I found that most patients, they're able to do exercises while standing. And so you want to do both sides. Just go over here, stand nice and straight, and you're going to bend to the side like this, and knock out 20. So next we want to work in the front and posterior plane. So I like to take a band here, like a thick band, and then you can kind of do some kind of variation where you attach it to a cage here. So have them right across the front of the chest. You want to make sure they contract their glutes and as well as tighten their abs. You want them to contract their stabilizing muscles. And just have them just flex into the band. So abs tight, glutes contracted, and it's going to pivot right at the hips, right like this. And that actually just gets those little intervertebral muscles just moving, especially for like sprain strains. This is really good because you can vary the amount of stress on the tissues. You can go all the way forward, or even I have some patients where I have them just move about an inch, just like this. It's similar to ankle sprain. You just want to get those muscles moving, just nice and easy, and that helps contract those muscles, and that's going to pump the swelling into the lymphatic system. So have them do about 20 going forward, and I'll have them do 20 in reverse here. So you tension the band, same thing, glutes contracted, tighten the abs. Just going to have them just work like this. And everything we do, we want it to be pain-free. So if they go forward and it hurts here, we want to stop right about here. Just do that motion. And it seems like a really simple exercise, but when you have a patient that is in a terrible amount of pain, this is just perfect for them, even though we move them an inch. And I've seen several cases where somebody goes from the first visit, this is the range of motion, second visit, all the way. So it's very effective. So, any questions? Visit us at westside-medical.com.